Okay, so we do the release.
Alex, this is the same patient
Yes.
that you have to operate it for CM joint arthritis?
Yes, yes, we just start, we were doing a carpal tunnel release, and now we suspend the hand in traction. Okay, no wall cam, so they see the suspension. Go to wall cam. And close later. Rosie, we need to hook down.
What kind of traction you use?
We use 5 pounds of traction.
Okay.
You got it done? You want to show them the x-ray?
Where are you going now?
Okay, now we'll show the x-ray of this patient.
You changed the position. Good, good, good.
This is a 65-year-old woman with 4 years of thumb pain. She's had 1 injection, splinting with persistent pain. We'll show you the x-ray now. She has a Eaton stage 3. Oh, great. Perhaps our first technical problem. Cannot see the x-ray. Okay. The signal will not go through the polycom, but okay. Zoom into the hand here, please. Externally. I need scissors, please.
This is medication for the thumb?
She has a wrist block and sedation. Zoom in. I need somebody, Rosie, stationed over here who knows this, who knows how to run this, because, okay. Okay, so here is your TM joint. There's a little subluxation.
Could you explain us, Alejandro, how do you feel,
yes.
How do you find the portals?
Marking pen, you have? The portals is really very easy. The central axis to the metacarpal is here, and you can palpate with subluxation. You palpate the metacarpal, and I go on either side. I go palmar to the insertion of the APL.
Yeah.
Okay, so here's our APL inserting here. And then the second portal I do with transillumination, which you'll see in a moment. So we introduce a little fluid just to distend the joint. Nice.
Brachial plexus anesthesia?
No, wrist block.
Wrist block. Can you show us the metacarpal?
I need these lights out of here. They're distracting me. Okay, there's the metacarpal, which also has loss.
Okay.
Typically here, the volar oblique ligament you see is redundant. Pinch it off.
It's a kyst lesion.
So it's usually, we see loss of the metacarpal base at the insertion of the volar oblique ligament, like here. But this is more advanced, so we see more widespread loss on the metacarpal. So first we simply debride, and we know now we're going to go with a burr and resect the trapezial surface superficially. Hold this down. And this is now the dorsal radial aspect. So the dorsal radial ligament would be in this area, which is usually where we insert the spacer.
Plane it now. To remove the synovitis.
So we plan to remove here, bud. So we plan now to remove this surface here to create, to increase the space. To increase the space in the joint and then put in a spacer. between the metacarpal between the metacarpal and the trapezium.
Alejandro, Christoph speaking. I would like to know if you use a burr and what size of burr do you use?
This is a 2.9 burr, which is now a Badia burr. This one is from Dionix. It's longitudinal. It's not the round burr because it makes the procedure a little faster. The problem always is the burr is a little bit big, so it's difficult to introduce, but you see the burr now. Yes, you see this is a long burr. It's not round.
Yes, it's like flat bone. Right.
Yes, flat. So
like a necromancer.
Yes. And now I divide the trapezium into 4 quadrants. So we will remove now the dorsal ulnar side.
Yeah.
Because this will make an increased space so we can do the rest of the procedure easier. Can you see?
Yeah, very well. Christoph speaking again. How many millimeters do you remove?
The burr is 2.9 millimeters, so I remove about 4 millimeters.
Oh, yes, a lot.
The depth of the burr.
Okay, I see.
Well, we want it to be good bleeding bone. The bone needs to bleed. And we also want to increase the space to decrease the... So now we will go deeper.
Alex,
Yes.
do you use always the 1R and 1U portal, or you change it with the portal of Slasky or the Volar 1?
Sometimes I use a phenol portal described by Orlano.
Yeah.
Yeah. I used Snetsky's portal on 2 occasions because there's a large osteophyte that doesn't allow me to insert the usual ulnar portal. But normally this surgery can be done very easily with just 2 portals.